So if there is a fracture, there is a 4 different stages that will happen. Okay, the first stage is that when there is damage in the bone, these bones also damage the blood vessels, so the blood is released here, and that will create hematoma. So hematoma is a collection of blood anywhere in the body, and in this case is in the bone. So here you can see that the blood is also accumulating under the periosteum and inside the medullary cavity. If these areas are really sharp, the edges of these bones, it can actually rupture the periosteum, and sometimes it ruptures the skin and the blood comes out. But most of the time it doesn't do that. So the small bones that are here, they usually die. These small pieces, they usually die. But because there is blood vessel, the blood vessel will grow back and then makes a specific type of tissue, and that type of tissue is called a soft callus. Soft callus is made of chondroblasts and also fibroblasts. So these fibroblasts are releasing or making these collagen fibers. It's a specific type of tissue that you can see only during bone repair, when the bone is fractured. So that is not a good and a strong tissue, so that has to convert to the bone. So here there is the area become more vascularized, and the soft bone is formed here. This is the spongy bone that is soft and is formed here. So this osteoblasts are making new bones, and then this area become calcified. But this is not, again, this is not strong enough, and this is called bone callus. It's not strong enough and does not have the same shape the bone had before. So the bone has to remodel, and for that you need osteoclast. So osteoclast will remove extra bone under the periosteum, extra bone in the medullary cavity, and also the osteocytes are formed here in the periphery, in the compact area of the bone, so the bone become back to the same level it was. So it depends on the person, depends on the age. This may take 6 months to 1 year. Normally after 3 months you usually don't feel it, but the actual repair still continues. The bone remodeling will continue for a while. So these are some clinical features that you can see of different fractures. This is called transverse fracture. So the two ends are not separated, but it's like this. So it's a transverse or perpendicular to the long axis of the bone. Displaced fracture means the two ends are totally separated. So during the repair, you actually have to pull that limb and connect these two bones together. So otherwise they will fuse like this, and that's not a good news. Compression fracture, it happens in the vertebrae. So this is actually one vertebra here, and you can see this is the thickness of the vertebra, but this is so narrow. So this is the other vertebra. So you can see that this is compressed. This happens the most commonly in osteoporosis, but you can have in tuberculosis and also in cancer. A spiral fracture is twisted like this. Okay, this is like twist. So this kind of fracture happens in contact sports and dancing, martial arts, soccer, football, things like that. So contact sports is mainly the one that causing this kind of fractures. And if the person during impaction twists and falls, then it will cause that kind of fracture, and it's a little bit harder to fix. Then is that fracture that is common in children, and that is called the green stick fracture, and the whole bone does not break, but only part of the bone breaks, and this is this area. So because the bones of the children are soft and they are not fully calcified, so that's why only part of it breaks. But please don't go and find a child and don't practice this to see if the bone of a child is soft or not. Okay, do not do that. Don't try that at home. Callus fracture is if you fall with outstretched hand. Outstretched hand. So this is one of the bones in the forearm. So the distal part of that bone, this is called radius. This is where it fractures. In the epiphyseal fracture, this is the epiphyseal part of the bone, so it means that if this part is still growing in a child or a younger teenager, then that's a problem because the area is still open, so that bone now become calcified, and one part of the body will be longer, the other part will be shorter, and that's not a good news. So this is actually in the lower limb, so this is a knee area. That's not a good area that the bone has fractured. Then is the paw fracture, and this is in the ankle area. So again, these are the two bones in the leg, and it's fractured around here. And finally, this is comminuted fracture, which means that bone has fractured into smaller pieces, and sometimes the sharp area ruptures the skin and the blood comes out, and that's an open fracture that is more difficult to treat. And finally, the effect of aging on the bone. So as you age, your bone is decreased, and there is increase in bone loss. Usually happens around age 35 or so. That is the time, plus minus 5 years. There is two different terminology there. One is called osteopenia, and this means one standard deviation below normal. And the second one is called osteoporosis, which is a 2.5 standard deviation below normal. Women are much more likely to have osteopenia and osteoporosis than men. Both of them will have it, but women are more likely. The reason is that women go through menopause and their hormones decrease rapidly, but in men, the testosterone is still there, and if somebody is even 70 or 80, they may still have some testosterone level. So they still lose bone, but their loss is more gradual. The area that there is a loss taking place, one is called epiphysis. This is the end of the long bones. The one that you can see it clinically in the hospital is usually the femur area or the hip bone. So if you see an older lady came with a fracture of a hip bone, that's the most likely cause is osteoporosis. This is what you see in the hospital. Another one is vertebrae. This is actually the most common location of osteoporosis. The picture that we saw, the X-ray image, this is the one. But clinically, you will not see this that much because this is very gradual, and this is why if you notice it, the height of grandma and grandpa usually decrease than when they were at a younger age, and that's because of the compression fracture of the vertebrae. Most of them does not have any pain. And there is also, you can see it in the jaws, and this is why as you become older, you may lose some teeth. That's because of the osteoporosis. This is one reason, okay? This is multiple other reasons for that, but this is one of the reasons for tooth loss. You do not have to memorize any of these percentages, but you can see that over age of 45, about 1/3 of women have osteoporosis, and 1/5 of men may have osteoporosis. So you do not need to memorize that, but just to give you an idea how common it is. And if you do exercise and if you take proper nutrition, proper nutrients, have proper nutrition, then the risk of osteoporosis decrease. There's also hormones if a person wants to take it, but that's a different issue because it may increase risk of some cancers. So that's controversial, and if you have any question, please ask me. So why there's a bone loss? Because decreased level of estrogen and androgen in both women and men, and that's why it's happening at the later part of life. So in the middle of the life and then after that, and it's more common in women because after menopause there is a sudden decrease and even loss of total estrogen level. So these women may need hormone replacement therapy if they are not at increased risk of breast or endometrial cancer. And if you have any question, please ask me, and thank you for listening.